4,000 more furloughs were announced, bringing the total up to 5,500. Now, UW Medicine Hospital leaders, they're also going to be taking cuts to their salaries. Even still, some hospital workers that we spoke to say they just do not agree with this move. While the demand for health care in the age of coronavirus remains high, UW Medicine says the pandemic has actually put them $500 million in the red. It announced today that along with 1,500 non-union employees, 4,000 union employees will be furloughed anywhere from 1 to 8 weeks, citing rising costs of PPE and treating COVID-19 positive patients, as well as a lack of revenue from elective surgeries as the reasons. In a statement, Lisa Brandenburg, president of UW Hospitals and Clinics, called the move a very difficult but necessary decision to address the financial challenges facing UW Medicine and all healthcare organizations responding to the COVID-19 pandemic.
Makes me feel sad that, my colleagues are going to be out of work and out of pay for many months when all of these people were willing to put their lives on the line for patients during the coronavirus.
Justin Gifford, a neurosurgery PA, is against the move, even creating a Twitter page along with some colleagues to voice their opposition.
It just makes me sad that, we make the working people kind of as the buffer for our system.
UW leaders will be taking pay cuts too, ranging from 10 to 20% of their salary, totaling $76.5 million.
I'm worried for the whole clinical enterprise.
Alexander Adami is a resident at Harborview, as well as the treasurer for the union UWHA, representing physicians and fellows. He says while he's not getting furloughed, the people who are either on the front lines or supporting those there.
It's difficult for me to take care of patients if there aren't enough nurses around, if there aren't enough technicians around, if the custodial staff who clean the rooms in between folks are not there. And it has a real impact when you're trying to just get patients where they need to be in the hospital.
UW Medicine assures patient care will remain high, saying the hospital has taken deliberate steps to not only take care of patients there, but in case of a surge as well. Gifford still has his concerns.
I can't say for a fact, what exactly will happen, but it's definitely going to be a lot more difficult for us to provide the quality of care that patients need to get better.
UW Medicine says that they have secured $180 million in federal funding to help out with their deficit. Also, regarding their COVID-19 local response and all the research they've been doing into the coronavirus, they say that these furloughs will have no impact on that. In Seattle, Vanessa Mashania, King 5 News.